Young athletes who specialize in one sport year-round or overtrain are at an increased risk of injury and mental burnout. And joining me now to talk about this new study is Dr. Nik Verma. He is the Director of Sports Medicine at Midwest Orthopaedics at Rush, and he's also the head team physician for the White Sox. Good morning to you. Thanks for coming in.
Thanks for having me.
So this is something we've been hearing a lot about, and this latest study is just kind of reconfirming what you already know and what parents are experiencing. So what are the biggest risks when it comes to these young athletes and overuse?
Well, I think the most important part of this study is we've always known over the last decade or so the risk to actual injuries, physical injuries that happen. We've seen that in baseball where the numbers of youth athletes undergoing surgery for things like Tommy John or shoulder problems has just skyrocketed. But what I really liked about this study was the fact that they kind of shined a light on the mental side and the burnout that happens where kids just drop out of sports because they just don't have the ability to put in the investment that's required for any level of participation at this point.
So you do surgeries from young to all ages, right?
Correct.
So with your experiences with the younger kids, when you've had to do like a Tommy John or something like that, do you find that mental aspect when you're sitting and talking to them about what they're going through?
Well, I think, first of all, the burden on them for the recovery is significant. But I think what's more interesting is not necessarily the surgery kids, but we see a lot of kids that come in that are just having vague complaints of pain. Sometimes we can't explain where the pain is coming from, or the MRIs and the studies look normal. And I think a lot of that relates to anxiety and just somatization or displaying pain maybe as a manifestation of the pressure they're under from the sports that they play.
Okay,
and that's one of the warning signs.
It's such a good point. And so we have parents who are at home watching who have kids in traveling sports and fun sports. They're doing double duty on a lot of things, and they're watching at home. What advice do you have for them when it comes to, how this is affecting our children and what we should be doing?
Yeah, so I think the first thing is to understand that what you're doing now probably has very little influence on if your kid has the it, right? I can take singing lessons until I'm blue in the face. It's just not going to happen.
Oh, interesting, yeah.
Number two is look for the warning signs. Talk to your kid about what it is they want out of youth sports. So things like withdrawing, change in personality, again, having vague pains that aren't really relating to an injury. Those are warning signs of a kid who's having anxiety related to sports. And then finally, if your child is involved in sports and maybe they do have the potential to play at the next level, you've got to be the CEO of their sports experience. We know that when these kids are playing year-round in a single sport, especially early, before skeletal maturity, so 16 to 18 years of age, they're going to be at higher risk for injury. So you just got to control it.
So let's talk about those injuries at an early age, if they are starting early, how that impacts them later as adults. What does that do to them physically?
Well, I think there's two things.
Arthritis, things like that?
Absolutely. Number one is it certainly does have effects later in life. If you tear your ACL or you tear your meniscus, your risk of arthritis is markedly increased. The second thing that we're seeing, for example, at the major league level is kids that would come in and maybe have a Tommy John in college or early in their pros are now having it at 14. What does that mean for their longevity of a career? So there are downstream effects that are real.
Yeah, okay. Well, we appreciate you joining us this morning. Great tips. I think this is great for parents to know. Very serious. But I am a little disturbed by the fact that I can't take voice lessons because I don't have it, and my voice is never going to change. You've totally ruined my morning for me. Great to have you on. Thank you. Very important advice. What do you think, T?
Yeah, very important conversation.